Hey everyone, welcome back to our channel. Today, we're diving into a topic that's often overlooked but incredibly important: foamy urine. If you've noticed frothy or bubbly urine, you're not alone. While it can sometimes be normal, persistent or severe foamy urine can indicate underlying health issues. Stick around as we explore the causes, mechanisms, diagnostic approaches, and treatments for this condition. First things first, let's define what foamy urine, also known as proteinuria, actually is. Foamy urine is characterized by bubbles or foam in your urine, which can be a sign of protein in your urine. While occasional foamy urine can be harmless, frequent occurrences might be a red flag. In simple terms, our urine can sometimes appear foamy if it contains proteins that usually aren't there. The presence of these proteins can make the urine frothy, much like soap creates bubbles in water. To understand foamy urine, we need to look at how our kidneys work. Our kidneys are remarkable organs that filter blood, removing waste and excess substances, which are then excreted as urine. Normally, proteins are retained in the bloodstream because they are large molecules that the kidney's filtering units, called glomeruli, typically do not allow to pass through. However, when the glomeruli are damaged, proteins can leak into the urine, causing it to appear foamy. This condition is known as proteinuria. The kidneys filter about 150 liters of blood daily, reabsorbing necessary substances and expelling waste products through urine. When this filtering mechanism is compromised, proteins like albumin can escape into the urine. Now, let's dive into the various causes of foamy urine. Chronic kidney disease, or CKD, is a major cause. Conditions like diabetic nephropathy and hypertensive nephrosclerosis can damage the glomeruli, leading to protein leakage. CKD is a progressive condition where the kidneys gradually lose their function over time. It can stem from a variety of causes, including diabetes and hypertension. Diabetic nephropathy is a leading cause of CKD. High blood sugar levels damage the blood vessels in the kidneys, impairing their filtering capacity and leading to protein leakage into the urine. Hypertensive nephrosclerosis results from chronic high blood pressure, which damages the glomeruli and can lead to proteinuria. This condition involves inflammation of the glomeruli and can result from infections, autoimmune diseases like lupus, or other systemic conditions. In CKD, the damage to the glomeruli and tubules disrupts the filtration barrier, allowing proteins to pass into the urine. This is not just a marker of kidney damage. It also contributes to further renal deterioration. Urinary tract infections (UTIs). UTI can cause foamy urine through several mechanisms, including inflammation and irritation of the urinary tract lining. Infections cause inflammation and irritation of the urinary tract lining, which can disrupt normal urine formation and lead to the presence of proteins, white blood cells, and bacteria in the urine. This severe kidney infection can cause significant inflammation and damage to the kidney's filtering units, resulting in proteinuria. Common symptoms of UTIs include a strong, persistent urge to urinate, a burning sensation during urination, cloudy or strong-smelling urine, and pelvic pain. Diagnosis typically involves a urinalysis to detect bacteria, white blood cells, and proteins in the urine, and a urine culture to identify the specific bacteria causing the infection. Dehydration occurs when the body loses more fluids than it takes in, leading to a reduced volume of urine that is more concentrated. This concentrated urine can appear foamy. Not drinking enough water can lead to dehydration, which increases the concentration of solutes in the urine. Excessive fluid loss from sweating, diarrhea, vomiting, or the use of diuretics can also result in dehydration. This condition involves inflammation of the glomeruli and can result from infections, autoimmune diseases like lupus, or other systemic conditions. In CKD, the damage to the glomeruli and tubules disrupts the filtration barrier, allowing proteins to pass into the urine. This is not just a marker of kidney damage. It also contributes to further renal deterioration. Urinary tract infections (UTI). UTIs can cause foamy urine through several mechanisms, including inflammation and irritation of the urinary tract lining. Infections cause inflammation and irritation of the urinary tract lining, which can disrupt normal urine formation and lead to the presence of proteins, white blood cells, and bacteria in the urine. This severe kidney infection can cause significant inflammation and damage to the kidneys filtering units, resulting in proteinuria. Common symptoms of UTIs include a strong, persistent urge to urinate, a burning sensation during urination, cloudy or strong-smelling urine, and pelvic pain. Diagnosis typically involves a urinalysis to detect bacteria, white blood cells, and proteins in the urine, and a urine culture to identify the specific bacteria causing the infection. Dehydration occurs when the body loses more fluids than it takes in, leading to a reduced volume of urine that is more concentrated. This concentrated urine can appear foamy. Not drinking enough water can lead to dehydration, which increases the concentration of solutes in the urine. Excessive fluid loss from sweating, diarrhea, vomiting, or the use of diuretics can also result in dehydration. When urine is highly concentrated due to dehydration, the higher concentration of urea and other solutes can increase the surface tension of the urine, leading to the formation of bubbles and a foamy appearance. Ensuring adequate hydration typically resolves this issue. Intense physical activity or heavy exercise can lead to a temporary condition known as exercise-induced proteinuria. During intense exercise, increased blood flow to the kidneys can temporarily alter the permeability of the glomeruli, allowing proteins to pass into the urine. Intense exercise can cause muscle breakdown, releasing proteins into the bloodstream that are filtered by the kidneys. Exercise-induced proteinuria is typically transient and resolves with rest and adequate hydration. It is not usually a cause for concern unless it persists or is accompanied by other symptoms. Preeclampsia is a pregnancy-related condition characterized by high blood pressure and significant proteinuria. It usually occurs after 20 weeks of gestation and can have serious implications for both the mother and the baby. The exact cause of preeclampsia is not fully understood, but it involves abnormalities in the development of the placenta. This can lead to poor blood flow to the placenta, causing the release of substances that affect the mother's blood vessels and kidneys, leading to high blood pressure and proteinuria. Preeclampsia can present with symptoms such as swelling, sudden weight gain, headaches, and vision changes. It is diagnosed through monitoring blood pressure and testing for protein in the urine. Management includes close monitoring, medication to control blood pressure, and sometimes early delivery of the baby if the condition is severe. Diagnosing the cause of foamy urine involves a comprehensive evaluation, including medical history, physical examination, and various tests. A urinalysis is a fundamental test that can detect the presence of proteins, blood, and other abnormalities in the urine. It typically involves a dipstick test and microscopic examination. A chemical strip changes color in the presence of protein, indicating proteinuria. Analyzing urine under a microscope to detect cells, crystals, and other substances. This test measures the amount of protein excreted in the urine over 24 hours. It provides a more accurate assessment of proteinuria compared to a single urine sample. Blood tests can evaluate kidney function and identify potential underlying causes of proteinuria. Important tests include serum creatinine, blood urea nitrogen bun, and estimated glomerular filtration rate (eGFR). Serum creatinine and bun. These tests measure kidney function. eGFR. This test calculates kidney function based on serum creatinine, age, gender, and body size. Blood glucose and hemoglobin A1C to check for diabetes. High cholesterol levels can be associated with kidney disease. Imaging studies such as ultrasound or CT scans can provide detailed pictures of the kidneys and urinary tract, helping to identify structural abnormalities or obstructions. In certain cases, a kidney biopsy may be necessary. This involves taking a small sample of kidney tissue for microscopic examination to determine the exact cause of kidney damage. Managing proteinuria involves addressing the underlying cause and taking steps to protect kidney function and overall health. Let's look at how we manage some of the conditions that cause proteinuria. Managing CKD involves controlling the conditions that contribute to kidney damage, including blood pressure and blood sugar control, dietary modifications, and regular monitoring. Medications such as ACE inhibitors or angiotensin II receptor blockers (ARBs) can reduce proteinuria and slow the progression of kidney disease. For diabetic nephropathy, maintaining blood sugar levels within the target range is crucial. Reducing salt and protein intake can help manage CKD. Regular checkups with a nephrologist to monitor kidney function and adjust treatment as needed. Treatment of UTIs typically involves antibiotics to eliminate the infection-causing bacteria, hydration, and pain relief. Antibiotics to eliminate the infection-causing bacteria. Drinking plenty of fluids to help flush out the bacteria. Ensuring adequate hydration is key to preventing and treating foamy urine caused by dehydration. Drinking water regularly throughout the day. Pale yellow urine typically indicates proper hydration. For those experiencing exercise-induced proteinuria, moderating exercise intensity and ensuring proper hydration can help. Moderate exercise intensity, adjusting the intensity and duration of workouts. Ensuring proper hydration before, during, and after exercise. Management of preeclampsia involves regular monitoring, medications to control blood pressure, and sometimes early delivery of the baby if necessary. Regular prenatal visits to monitor blood pressure and urine protein levels. Antihypertensive medications to control blood pressure. In severe cases, hospitalization may be required to closely monitor the mother and baby. Early delivery may be necessary if preeclampsia poses a risk to the mother or baby. Preventing proteinuria involves adopting a healthy lifestyle and managing underlying health conditions effectively. A balanced diet can help manage and prevent conditions that lead to proteinuria. Low-sugar diet, reducing carbohydrates intake can help control blood pressure. Balanced diet, including plenty of fruits, vegetables, whole grains, and lean proteins. For those with kidney disease, moderating protein intake can reduce kidney workload. Engaging in regular, moderate exercise can help maintain overall health and control conditions like hypertension and diabetes. Regular, moderate exercise can help maintain overall health. Drinking enough water daily is crucial for kidney health. Regular checkups can help monitor and manage conditions like diabetes and hypertension. Routine tests to assess kidney function, especially for those at risk of kidney disease. Foamy urine, or proteinuria, is a symptom that warrants attention, as it can indicate underlying health issues, particularly related to kidney function. Understanding the causes, from chronic kidney disease and urinary tract infections to dehydration, excessive physical activity, and preeclampsia, is crucial for proper diagnosis and management. Diagnostic approaches include urinalysis, blood tests, imaging studies, and sometimes kidney biopsy. Management involves treating the underlying conditions, adopting healthy lifestyle modifications, and ensuring regular medical follow-ups. Persistent or severe foamy urine should not be ignored. Early detection and intervention can prevent further kidney damage and improve overall health outcomes. Therefore, individuals experiencing this symptom should seek medical advice to determine the cause and appropriate treatment. Thanks for watching. If you found this video helpful, please give it a thumbs up. And don't forget to subscribe to our channel for more health insights. Stay healthy and take care.